now to the pandemic. The Omicron variant of the coronavirus is not going away. The BA.5 subvariant, now circulating in the U.S., may be the most contagious yet. It accounts for more than half of the cases, with infections surging across all age groups. Dr. Celine Gounder is editor-at-large for KFF's Kaiser Health News and an infectious disease specialist. Good morning to you. What do we know as far as the severity of illness, the seriousness of the BA.5 that seems to be more contagious?
There are early hints that the BA.5 subvariant of Omicron may be more virulent, so in other words, may cause more severe disease. It's a little early to say. This is based on animal data. But at the same time, if this is spreading widely, if we're seeing a lot of people infected, even a small percentage of many people means a lot of people in the hospital.
Yeah, that's what I was going to ask. Hospitalizations, deaths, is there more concern now that we'll see some of those numbers go up as well?
We are seeing hospitalizations go up. The good news is most of those people are not ending up in the ICU. The percentage ending up in the ICU is a lot lower than in previous waves. But I think it's really important to hammer home, vaccines work. So the parts of the country, the counties where you have that biggest increase in hospitalizations, these are counties that have lower vaccination rates, somewhere between the 30s and 60% fully vaccinated.
About 300,000 children under the age of 5 have received a vaccine dose for COVID-19. Another 18 million have not. Are you concerned about that pace?
My colleagues at the Kaiser Family Foundation have done polling on this. About 1 in 5 parents of kids under 5 plan to get their kid vaccinated right away. That includes my 3-year-old niece, who has an appointment next week.
Okay.
We're very excited about that. But then you have another 40% or so who want to wait and see. And I think the question is going to be, how long? How long do they want to wait and see? And then you have another 40% who are like, no way, not unless there's a requirement. So I do think there's work to be done to encourage parents, and pediatricians are going to be really central to that.
On the timing question, and forgive me if you mentioned this, but if for grown-ups who are thinking about an Omicron booster that might be available in the fall, should they get a booster now that's not Omicron specific, or should they wait?
Tony, I've been getting this question a lot over and over again. I think people are really confused. Do not try to game this out. If you are eligible for a vaccine, so if you are over 50, 50 and up, and anybody who has an immunocompromising condition is eligible for that second booster, so that 4th dose of vaccine. Don't wait. Getting a booster now will not prevent you from getting the updated vaccine in the fall.
I was going to say, so then there might be another, I was going to say a 5th, but it depends how many shots you have. You may be looking for one more because, as you said, this still is, the vaccines are working the way that they are supposed to.
They are working the way they're supposed to, but the virus continues to mutate. BA.5, you can think of it as Omicron number 5, is really different from the original Omicron, the OG. There's a big difference between the two. And so even if you had your vaccinations, even if you had an infection with Omicron, your protection against BA.5, Omicron number 5, is just not as good.
Looking down the line, is this going to become the norm? I have friends and family that are asking me, Nate, are we just going to be taking this many shots every single year?
Yeah.
What do you think?
When do you, like, I have a family member who wants to go to a funeral. It's actually my mom, actually, has COVID positive. Her brother died. Now she can't go and participate fully in the funeral on Saturday because when are we going to get to a point where people are like, you know what, it's like the flu. You can still do big, important things in your life that are really, that matter.
Right.
I think this is going to take a couple years. You're probably looking at least another year or two of more variants emerging, trying to match the vaccine to the variant, more boosters, especially for older people, immunocompromised people. Eventually, this will plateau and settle out, but we're not quite there yet.
Wow. It feels like we've been saying a couple years for a couple years. But Dr. Gounder, thank you. We appreciate it. It's not on you. We know that.
You're right.